Protecting your health in winter, understanding cold weather risks. Introduction. Winter may bring picturesque snowfalls and cozy nights, but it also presents several health risks that should not be overlooked, from increased chances of falls and heart strain to weakened immunity and heightened susceptibility to illness. Cold weather can take a toll on overall well-being. Understanding these risks and taking preventive measures can help you stay safe and healthy throughout the winter months. Increased risk of falls and heart strain. Slippery sidewalks and icy driveways significantly increase the risk of falls, especially among older adults. Fractures, particularly hip fractures, become more common during winter due to these hazardous conditions. Wearing shoes with good traction, using handrails, and walking carefully on ice can help minimize these risks. Winter activities like shoveling snow, while seemingly routine, can pose serious risks for those with underlying heart conditions. Studies have shown that shoveling snow can raise heart rate and blood pressure, increasing the likelihood of angina, chest pain, or even heart attacks. Cold air constricts blood vessels, making the heart work harder to pump blood. If you have heart disease or risk factors for heart problems, it's best to take frequent breaks, use a smaller shovel to reduce strain, or seek assistance when needed. Cold weather and immune system function. Contrary to popular belief, the cold itself does not directly cause illnesses like colds and flu. However, research indicates that cold, dry air can weaken the immune system's first line of defense, nasal and respiratory tract cells. When exposed to frigid air, these cells have a harder time fighting off viral invaders, making infections more likely to take hold. In addition, during winter months, people tend to stay indoors in close proximity to others, increasing the spread of airborne viruses through coughs, sneezes, and surface contact. Schools, offices, and public spaces become hot spots for cold and flu transmission. Proper ventilation, frequent hand washing, and maintaining personal space can help mitigate the risk. Vulnerable populations and winter health challenges. Certain groups are more susceptible to the adverse effects of cold weather. Children lose body heat more rapidly than adults due to their smaller size and higher surface area relative to their weight. They may not always recognize signs of excessive cold exposure, making them vulnerable to hypothermia. Older adults often struggle with body temperature regulation due to thinner skin, reduced muscle mass, and conditions such as hypothyroidism or diabetes. Medications like beta blockers can also impair the body's response to cold. Seniors should dress in layers, keep their homes sufficiently heated, and avoid prolonged outdoor exposure in frigid temperatures. Individuals with respiratory conditions such as asthma and chronic obstructive pulmonary disease, COPD, may experience worsened symptoms due to cold, dry air. Breathing through a scarf or mask can help warm the air before it enters the lungs, reducing irritation. Winter weather and mucous membranes. Cold air can dry out mucous membranes, exacerbating congestion and prolonging illness symptoms. Dry air indoors, often caused by heating systems, can further irritate nasal passages, leading to discomfort and an increased risk of sinus infections. Using a humidifier to maintain indoor humidity levels between 40 to 50% can help alleviate dryness and keep the respiratory system functioning optimally. Preventing cold-related health issues. Taking proactive steps can help minimize the risks associated with winter weather. Dress appropriately by wearing layers, insulating clothing, and waterproof outerwear to retain body heat. Covering exposed skin with gloves, scarves, and hats helps reduce heat loss. Protect your respiratory system by covering your mouth and nose with a scarf to warm and humidify the air before inhaling. This is particularly helpful for those with asthma or other respiratory conditions. Support your immune system by prioritizing adequate sleep, regular exercise, and a nutrient-dense diet rich in vitamins C and D. Maintaining hydration is also essential, even in colder weather when thirst cues may be diminished. Limit outdoor exposure during extreme cold, especially for young children, elderly individuals, and those with existing health conditions. If you must go outside, ensure that trips are brief and that you have warm shelter available. Recognize signs of frostbite and hypothermia. Early symptoms of frostbite include numbness, skin discoloration, and tingling in fingers, toes, nose, and ears. If frostbite occurs, gently warm the area using body heat or warm water, and avoid rubbing the affected skin. Seek medical attention for severe cases. Hypothermia, a dangerous drop in body temperature, manifests as confusion, shivering, and slowed breathing. If suspected, immediate warming and emergency care are necessary. Conclusion. Winter weather presents unique health challenges, but with the right precautions, you can protect yourself and your loved ones from its adverse effects. Being mindful of the risks, dressing appropriately, supporting immune function, and maintaining a warm and safe environment are all essential steps in ensuring a healthy winter season.